New report is out listing the leading causes of death around the world, and the data is showing a shift in the conditions of top concern. CTV's medical expert, Dr. Marla Shapiro, is joining us now with more. Good morning to you, Dr. Marla. So what are we seeing from this report on the leading causes of death around the world? A change?
We are seeing a change, and what you see globally is a little bit different than what we see in Canada. But in 2021 and 2020, when you and I would chat, and we were chatting remotely then, we were chatting because the #1 killer then was COVID.
Yep.
And as of 2023, that's now moved to the 20th cause of death. But that means that heart disease, stroke, chronic obstructive lung disease, they're all now moving up the list to where they were in the pre-pandemic levels. So, you know, women often underestimate heart disease and stroke, and they worry about things like breast cancer, which we'll get to in a moment. But globally, heart, stroke, lung, smoking, that kind of thing leads the list again.
Okay, so talk to us about the other global trends then that we're seeing.
So globally, it's going to be country specific. Obviously, middle income countries are a little bit different than lower income countries in terms of what we see. But when we look, for example, in a place like here, overall, the population is healthier. The life expectancy is longer than our pre-pandemic levels and our pandemic levels. So we're looking at women outpacing men, which is usually the case. Almost 77 years old for females, just about 71 and a half year old for males. So there is that gender difference that we do see, and we do see it globally as well.
That seems young.
It does seem young. It does, and often in my own practice, I'm seeing patients well into their 80s and 90s. But again, this is a global trend that we're looking at, not necessarily what we're seeing in high-income countries.
So what are the big concerns then being flagged?
So the concerns are the fact that we are beginning to see those diseases that we saw before right up there. So let's think about vaccine preventable health. Globally around the world, there's either issues with access to vaccines, and Gavi at the World Health Organization has done a lot for global access. But here and within our own countries, we've got a lot of issues in terms of the mixed messages about vaccines, and vaccine preventable health is really a concern. Maternal health, third world countries, still remains a big concern. Now, non-communicable diseases, those rates are surging, so think about your cancers. So those are the ones when we think about non-communicable. And in terms of disability and years lost of life because of disability, we often think about liver and liver disease and cirrhosis, but Alzheimer's now is up there in the top 25 cases of causes of disability. And mental health, we've seen that be an ongoing concern during the pandemic, and then even post-pandemic, it still is a concern.
Still a concern. Are we making headway, or where are we going on the whole mental health?
Yeah, I think we have to do better. We have to do better. For example, if we look in our own country and we look at what's happening with our teen rates, you know, we've seen that that mental health crisis is still there. Anxiety and depression have had the largest increases in that 15 to 49-year-old age period. We have increases in the rates of death, those so-called deaths of despair, which include drug overdose and alcoholism. That's something that we have not yet conquered. We've seen a lot happen in terms of the opioid crisis. Things are moving in the right direction, but still those deaths of despair are still there and still in that age 15 to 49.
So let's end on a semi-positive note then. What are we learning about prevention, or what can the takeaway on prevention be?
There is a lot of takeaway there as far as prevention is concerned, because we do know that a lot of these issues have preventions. Modifiable risk factors. So when we think about non-communicable diseases like the cancers, we think about smoking, we think about obesity, we think about our diet. Really important. Exercise. High systolic blood pressure, that first number when we measure your blood pressure, still remains a target that we want to get down. That's a risk for heart attack and stroke. Particulate matter and pollution is a real concern. If you have a high fasting glucose, we're seeing trends in diabetes increasing, obesity increasing, smoking, as I mentioned, that high BMI. Those are all modifiable. Those are all things that you can do something about that really pays it forward in terms of risk of non-communicable diseases like cancer, diabetes, heart attack, and stroke. Those are things that you really can make a difference of.
Really fascinating stuff. Dr. Marla, thank you so much. Great, as always, to see you this morning.
See you next time.